Prescription opioid overprescribing, as well as opioid misuse and overdose, remain significant U.S. public health issues. Since many patients initially consult their primary care physicians for treatment, these providers are critical to many ongoing and proposed efforts to address the opioid epidemic. To address a deficit in educational resources for clinicians, the University of Michigan Injury Prevention Center, in partnership with the Michigan Department of Health and Human Services, created the Michigan Safer Opioid Prescribing Toolkit, one of the first fully online, comprehensive, evidence-based clinical resources to address the opioid epidemic. When you land on the Toolkit homepage, you'll see resources curated across 8 domains. If you hover your cursor over a section's icon, a brief description of what you can find in that section will appear. You can also use the menu at the top of the screen to explore the toolkit and directly navigate to a specific page. The toolkit has some excellent information for primary care providers. Taking some time to click through each section is a great way to see what the toolkit has to offer and allows you to review the topics that interest you most. The JustInTime Tools section is particularly helpful as it can be accessed throughout the day while working in the clinic. The clinical decision flow sheet can be found here and downloaded on the spot. It features embedded links to other helpful resources like assessment tools and prescribing guidelines, making it a one-stop resource during a busy clinical day. The Linkage to Services section offers provider-facing resources, including screening tools to evaluate substance use disorder risk, actions to take for patients with a positive substance use disorder screen, and linkages to service for substance use disorders or co-occurring mental health disorders. This is a great resource for primary care physicians who do not have access to a social worker in their office. The section on prescribing guidelines offers resources and recommendations for safer opioid prescribing. You'll find a summary of best practices from the CDC and the state of Michigan that are geared towards providers in multiple settings, including primary care. Special populations, such as adolescents and older adults, have a separate section containing tailored resources. Each section offers unique information on managing pain and treating substance use disorders for that specific group of people. This can be particularly helpful for primary care providers who work with specialized populations. Additional information on having conversations with patients can be found in the background section of the toolkit under Difficult Conversations. Here, there are resources on building strong patient-provider rapport, including examples of what you might say to a patient in different situations. There is also a section on reducing stigma. Here, you will find an anti-stigma toolkit, as well as webinars and articles that discuss stigmatizing language that should be avoided when discussing opioid and substance abuse. One of these resources, the Words Matter handout, was created as a guide for using people-first, non-stigmatizing language. Also, under the Handouts tab, there are additional handouts and posters that can be tailored to your practice and include your organization or clinic's logo. You can even find a sample pain agreement that you can edit and use with your own patients. For those providers who are waiver trained, the post-overdose care in the ED section on the far right of the screen contains valuable information regarding medication for OUD that is also applicable in the primary care setting. The toolkit is continually updated with the newest, most up-to-date information for you and your practice. Scroll to the end of any page in the toolkit to sign up for our listserv to be notified when new resources are added. If you have resources that you think would make a good addition to the toolkit, or for any other inquiries, contact us at uminjurycenter@umich.edu. You can also click on the evaluation button at the bottom of the homepage or the contact and subscribe button on the bottom of each page to leave your feedback and suggestions.